Accessible Information Standard was introduced by the NHS last year, back in July 2016. And what this mandated was that information had to be provided in an accessible format for people who maybe had a disability or a sensory loss or impairment. So the information would be made to them in a format which was accessible, which was clear, which was understandable, so they could have clear information from the NHS and from health, public, private and social care. I think it's a good move, but primarily it's a step in the right direction. This is something which has been growing through time. The NHS also, it fell under the Equality Act, but it also had its own information standard, and the Accessible Information Standard has grew on this and has developed upon this, which is something that we see happen in all aspects of life. As times change, how we access our information has changed through times, and it's something that's had to happen. You think of the deaf population. If you look at some of the statistics, around 15% of the deaf population have missed an appointment simply because they've been sitting in their GP's waiting room and an announcement has been made, which they haven't heard. So it's simple steps, simple acts that can be made, and providing accessible information means that we can save money as a health service and we can save money across the NHS. Well, the reality is, providing accessible information is very expensive, it's very costly, and it can also be very time consuming as well. You speak to some NHS trusts and they'll tell you to provide a piece of written information in an MP3 format which someone can listen to. It can take up to 6 days if you're putting that out to another agency to record and produce that information. Now, where assistive technology comes in, you can use BrowseAloud to convert a piece of written text into an MP3 within a matter of seconds, and for a fraction of the cost of asking an outside agency to do that. Instead of you having to go online and convert a PDF and increase the size of it and print that out and provide that to a member of the public, they can go onto a website and they can use assistive technology to increase the size, to increase the font, to change the colour of it to make it easier to read, and they can do that in a fraction of the time. So being able to signpost someone to your website, being able to direct them to perhaps a library where they can access the information, all of a sudden you're removing barriers and you're removing costs and you're removing some of those time hurdles, because quite often this information is quite timely for the patient involved. Well, currently there's around 60 trusts across England who have embraced BrowseAloud upon their website, so that they know that when they direct people to their website, they have the confidence and the assurance to know that that information is provided in an accessible format. But increasingly we're getting more and more inquiries through from the primary sector, where more GP surgeries are asking, how can we make our information more accessible? How can we make sure that our web platforms, which they have to provide by law, that those web platforms are fully accessible? So if someone is going on to book an appointment or to order a repeat prescription, they know that if that person has a communication challenge, that platform has been made accessible for them. I think it'll make a massive difference in regards to, you think of something simple, if you receive a referral letter and you don't understand that referral letter, you're going to miss your appointment. Think of the millions that the NHS England could save just by people making their appointments on time. And that's a small thing, a very, very small step. But the more information we provide in accessible formats, there's going to be more cost savings, there's going to be more time savings, there's going to be more additional resources available for the other areas of care where the NHS needs that funding. So I think it is a massive step and it can make a big change. And I hopefully think this is something which just doesn't apply to healthcare. This is something that can apply to all areas of life. These sorts of accessible information standards, why are these not available in other arenas of public life and not just healthcare? So I think it's a real positive step in the right direction.